Hi, everybody. This is Joyce Edwards, and coming from my home office. Wanted to talk to you a little bit on this video about the Affordable Health Care Act. Now, if you haven't heard about the Affordable Health Care Act, I don't know, have you been living under a rock? I mean, that's all the politicians are talking about, and the news people. You're constantly bombarded about this. In case you haven't heard, we're all supposed to get health insurance. And it's going to be great because it's going to be affordable for everybody. So, I do carry my own health insurance, and, recently I did get a couple of letters from my health insurance carrier, and, I was really surprised to see that the price went up. Now, I thought the whole thing with the Affordable Health Care Act was supposed to be affordable to me, and it was supposed to be less money. So that didn't happen. My premium, which is my monthly payment, is going to go up about $25, maybe $30. Okay, I can deal with that. Okay? But the shocking thing about this is I went from a $3,500 a year deductible to a $6,000 deductible. That's right, $6,000. So what does that mean? Okay, that means that every time I go to the doctor, I'm going to have to pay him $90. Okay, that means when I have some blood tests done, I'm going to have to pay for the whole bill. Now, sure, I'm going to get a little bit of a discount. Like, let's say I have some blood drawn and a few different tests, and it comes out to be $200. That's what the lab is going to charge me. Okay. Well, because I have insurance, they might knock off $20. So I'm going to be stuck with a bill of $180. Until I reach the $6,000 minimum, okay? If I go in and the doctor says, well, let's just do a CT. Well, CTs are about $3,000. That's going to come out of my pocket. That's not affordable to me. I'm going to be paying more money out of pocket for my health care. So that's not what I call affordable. So then I thought, well, let me get on the Affordable Health Care website and see what's going on. So since I live in Illinois, first I went to the Illinois one. They ask you maybe about 5 or 10 different questions and stuff. And at the end of it, it's like, do you make over $1,100 a month or under $1,100 a month? Well, since I make over $1,100 a month, I clicked on that. Well, that shot me straight to the government program. Okay, the federal government program. All right. Of course, the first time I got on, it didn't work. The second time I got on, I was able to answer some of the questions, but it was taking too long, so I got off. Got on again, got a little further. Got on the fourth time, I got through. Okay, so it took me 4 times to take a look at this. And of course, I had to put in all my information, how much I made, all these different questions. It was slower than a snail to get through this thing. And then at the end, when it came up with the 4 different programs that they're offering, come on, a silver, a gold, a bronze, a whatever, probably platinum. Basically, they were exactly the same program that my provider right now is offering me. So being on the government thing, it wasn't going to be any different than what I already have. So, hey, we all need insurance. I understand that. We all should have some kind of program. There should be something with healthcare. I get that. But I'm 59 years old. Why do I need maternity care? And that's another little stipulation that the insurance companies had to do. They had to make the policy so everybody was going to be the same. So here I am, 59 years old, and I'm going to have maternity coverage for the first time in my life? That ship sailed a long time ago. Okay, I don't need it, but I still have to pay for it. Of course, my insurer says, oh, you won't be paying for it. Oh, nonsense. You are paying for it. Then also pediatric dental care. I have no kids. Why would I need pediatric dental care? And if I did have children, they would be, in their 30s by now. So why would I be paying for their dental care? The one thing, maybe I can get my dog's dental care covered on that because she's only 3 years old. So maybe I can get her on the pediatric dental care program. Take her in for that. Well, that's a thought. So I know it could be upsetting for a lot of people. I've heard crazy numbers, $12,000 deductible. And I'll tell you, if you have that, you're going to have to pay that money out of pocket before your insurance is going to kick in. So I don't know what these politicians were thinking, that this was going to be affordable for everybody. And people that make less income, yeah, they'll go on the Medicaid or public assistance, or they love to call it the medical card now. Now they're not going to be paying for anything. They're going to pay, when they come into the doctor's office, they're going to pay $3.90. Whoopee. And I'll tell you, there's a lot of cheating in that, but that's for a different video. So, this could be very upsetting to a lot of people, and I'm upset about it because, if I have to have surgery, that means I have to save up $6,000 before my insurance company is even going to cover it. This is going to be a big trickle-down effect that's really going to, people will wake up after a while. But what I'm suggesting to you, especially if you're a baby boomer like me and you're kind of in the middle, you're not, into Medicare yet, and you still have to pay for your own health care, you need another source of income. There is no two ways about it. And if you're looking for a way to make money, you need to get online. It's the simplest way for you to do it because you can work from your home. It's easy to learn. You don't have to start a brick and mortar business. And depending on what you're doing right now, this could be a source of income well through your golden years. So, I want you to take a look at what I'm doing. Click the link below. And if you have any questions, just give me a call. All my information is down there. Okay? Talk to you later. Bye-bye.